Assalamualaikum doctors. In this video I am discussing non-accidental injury NAI history management. NAI is very important. It comes on video stations and sometimes it can be come on the clinical. We can find the X-ray, they show that spiral fracture. Okay, so mainly video station and the history. So NAI differential diagnosis I am telling, then I am going to the management. NAI differential, it can be neglect, it can be rickets, osteogenesis imperfecta and immunodeficiency. So how can I manage? First of all, I have taken the history. The patient come, I will assess the patient carefully. I will assess the ABC, airway, breathing and circulations and vitals. I will assess the dehydration status in the form of capillary refill time, perfusion, amount of urine in the nappies, skin turgor, entry frontally, is it bulging or depressed. So hydration status, CRT, perfusion, amount of urine in the nappies, skin turgor, entry frontally, is it bulging or depressed. The nutritional assessment by skin fold thickness and mid-arm circumference. I will do a full skin examination and glass test, full musculoskeletal examination with a full range of movements, full cardiac, chest and abdominal examination. So everything, every system I will be examining. Then I will examine the patient generally for signs of NAI. From nail, if I start, I find long, dirty with koilonychia. Arms, pulse, muscle wasting, deformities, burn marks, broadening of the wrist joint. Then head, about the shape, head circumference, craniotapes, anterofrontonally, bulging for ICT and depressed in dehydration. Then about the eye, the pallor, bluish sclera, subconjunctival hemorrhage, shrunken eyes, if tear or not, reconi. Then about the nose, any discharge from the nose, CSF. Mouth, about the pallor, broken teeth, torn frenulum and dry or moist. Ear, any discharge or blood from the ear, battle sign on the back of the ear. Okay. Lymph node examinations, back bruises and deformity. Chest, CRT on the sternum, rosaries, deformities, fractures or bruise. Then abdomen, dirty umbilicus, dehydration, bruise and palpate for toast of liver. Genital and napiaria, nappy rash, ammonical dermatitis, petulous anus, urine output. Lower limb bowing deformities, callus formation and Marfan sign. Okay. So these are one by one I examine. Then I will involve my senior, my consultant for admission. Remember, admit the NAI patient and involve your consultant. I will involve the child protection team, safeguarding consultant, social worker and police. Okay, so child protection team, safeguarding, social worker, my consultant, admit. ABC, correct dehydration if present, take his vitals, take his measures and plot on the centiles appropriate for age and sex. If the child in pain, I will give analgesic. Document any bruise by photos and comment on the color and nature of rash and bruises. Also document interaction between the child and the caregiver. Full septic child abuse form and document general state of the child and details of all body area examination. Revise his file for previous documentation. Check the safety of the child at home, treat injuries accordingly and test to exclude other differentials. What investigation we do in NAI? Remember, first of all, full blood count we will do, coagulation profile, liver function test, bone profile, 24-hour hydroxyproline in urine, blood grouping, factor 8 and factor 9. Okay, so full blood count, coagulation profile, liver function test, bone profile, 24-hour hydroxyproline in urine, blood grouping and factor 8 and factor 9. X-ray of the wrist, CT brain if less than 1 year or head injuries. Skeletal survey if less than 2 years, repeat after 14 days. DEXA scan for bone density which may be diagnostic if he has osteogenesis imperfecta or X-linked dominant hypophosphatemia rickets. Then fundoscopy for retinal hemorrhage. So fundoscopy for retinal hemorrhage, X-ray wrist, skeletal survey, DEXA scan for bone density and the fundoscopy for retinal hemorrhage. Thank you.